Advocacy is all about relationships, George. And we as counselors know how to build relationships.
Welcome to Positive Recovery MD. If you're listening, chances are you want to create happiness around you and thrive in your life. We're glad you're here and you've come to the right place. This podcast will inspire and motivate you to not merely survive your recovery journey. We'll give you the tools to build or strengthen your foundation to thrive and flourish in your life. In each episode, we will come together as a community to have authentic conversations around addiction, recovery, and what matters, growth and progress, not perfection, all while developing positive habits for you to utilize. To learn more, please visit positiverecovery.com/podcasts to sign up and to receive the daily positive interventions that we'll review, as well as gain access to exclusive Positive Recovery content available only to Positive Recovery MD listeners. All right, let's get started.
All right, welcome to Positive Recovery MD. I'm your guest host tonight, George Joseph. And we are so delighted to have Sherri Layton, the advocacy guru, goddess of Texas, or maybe the United States in our addiction field. And we want to pick her brain about how we can help and also what's going on. And more importantly, I'd love to know how she got into it and really, one, how you got in the field, but number two, how you've kind of pivoted toward advocacy.
Well, thanks, Joseph. I'm so excited to be here and to have this opportunity. As I was saying before we started, I really love talking about advocacy. So, any chance I get to do that, I'm thrilled. I've been working in addiction treatment services since 1977. So 47 years, something like that. I did not intend for this to become my lifelong career, but it did. It started out with a summer job at a psychiatric hospital and drug and alcohol substance unit back in Houston. My qualifications for the job was I was in recovery and I knew how to take blood pressures. And that because I had some nurse's aide background. And I was a psych tech. And I always said,
what was the name of the program? What was the name of the hospital?
Houston International Hospital.
Oh, HIH. Absolutely. It was famous. I referred people there back then, long time ago.
Dr. Jason Barron.
They had a great adolescent program for many years.
Yes. And then I went to Deer Park Hospital when they opened that back in the late 1970s. So I was a psych tech, and I worked the 3 to 11 shift, and I took patients to meetings and just kept up with patients was pretty much my job. And it became something I just developed into. I went to work in counseling for the Palmer Drug Abuse Program in Houston. And that was the program that introduced me to recovery. And from there, I just kept going. So, and working as a counselor, was certified initially, became, in the first round of licensed counselors in Texas when we grandfathered in from certification. And in the early 1990s, and then went to work for La Hacienda Treatment Center in 1992, and I've been there ever since. So 32 years, and I've had incredible opportunities there. I started out there as the director of the counselor intern program. Over time and circumstances in my life, things evolved for me. I gravitated more towards administration, which, I really considered that to be the dark side when I was a counselor. And then in about 2005 or so, I attended a NAADC conference that was held in Washington, D.C. NAADC's the National Association for Addiction Professionals. And attached to that conference, they had a Hill Day at the end. The final day was a Hill Day. And because I was there and I didn't know any better, I just went to Hill Day. I got on the bus that morning with a bunch of other people and absolutely clueless and sat across the aisle from a guy named Frank from Long Island, and everything you can imagine that would be a stereotype of a guy from Long Island. He was that, but gracious to me and helpful. And I leaned over at one point and I said, "What are we going to do today?" And he said, "You don't know anything?" And I said, "No, I've never done this." He said, "Well, you just come with me." And we had a breakfast that morning. and to start the day, and he was awarded legislative advocate of the year by NADAC. And I thought, for
Nice.
I sat by the right guy, and he dragged me along with him through the
Yep.
Capitol that day. And at the end of that day, going home, I thought, I think I can do this. This isn't that hard, because anything like that, and most people I talk to, it's like, this is so intimidating. How do you even start to do this? How do you know what to do? And I had no training. I tell people the only kind of government training I ever had was my 8th grade government teacher, who told me, told our class, if you don't vote, you can't complain. And that was my introduction to government 101, so to speak. That was my introduction. But I think what happened for me, George, was I pretty quickly put it together as to why this is important for treatment providers. And one of the things that we were advocating for in 2005 was parity, was passing the federal parity law.
Yep.
And parity is the law that says if your insurance policy covers mental health and substance use services, it has to cover them just like they cover medical and surgical conditions. And so I went back to my boss, to Art Vanderveer at La Hacienda, and I said, this would benefit us. We need to work on this. And he said, well, go work on it then. And he really gave me the freedom to get involved with advocacy, supported me in doing that. And La Hacienda began to see and began to really focus on the value that this had, not just for them as a provider, but for all providers. So that's kind of how I got started.
So Sherri, I know Art Vanderveer, and it sounds like a perfect Art answer. Go do it. And in your travels, obviously you never thought you'd become a counselor, and obviously you never thought you'd get into advocacy, but in your travels, do you have any great stories about maybe when you were counseling some situation that really impacted you to want to be a counselor? And number two, was it, besides your meeting with Frank, the Long Island Teamster, maybe? I don't know how, in my mind, I'm picturing him as a Teamster. But in your advocacy adventures, is there any one story that's been so impactful that you this is, what I'm doing is making a difference, and it's, it means meaningful to me? Maybe you could share a couple of those stories, because one of the things I want to talk about today is that there's thousands and thousands of people going through treatment, and there's several that want to become counselors. And for a long time, I think we did more to encourage that. Whereas now I think there's less opportunities, or maybe less interest, or I don't know what it is, but we're not producing the numbers of counselors that we once did. I remember the University of Houston used to have hundreds of people in there. They had an LCDC training program. We had a program called Cadwalder in Houston that had tons of people. And now the training programs are, in the low numbers, where they were used to be in the hundreds each year. Now, obviously, not everybody qualified. Some were just interested and never pursued the industry. But as a leader of a facility, we're sometimes struggling to get enough high quality counselors, and the pool is not that deep out there. So maybe you can talk about, how you got created into this industry, but, some of the stories that helped you along the way.
Well, I think you're right. We do have a huge workforce crisis, and it's across all of healthcare. It's not just in behavioral healthcare or in addiction services. And that question is, for me, the question is, how do you make somebody want to become an addiction counselor? And so many of the folks that, as you and I know, so many folks have come in after they've started their own recovery journey. And for many, it's a second career or a third career. So we're getting, we don't get that in high school, I want to be an addiction counselor. How do I go to college to do that? Although that I've heard of that with some people. So, that idea that this is a profession that people can pursue, I think is a part of that. And there's so much stigma, George, around addiction. And because so many, it's hard to find a family that hasn't been impacted by addiction. And I talked to a gentleman this past Saturday night, and I told him, that I do advocacy work for addiction services. And he said, oh, he said, I have an addiction in my family. And when somebody says that, you never know what the next sentence is going to be. It's, my brother who's never been able to be sober for any period of time. But he said to me, my brother's a recovered alcoholic and he's very active in AA. So he has seen the positive of that. A lot of people who, their family member, their loved one has struggled with getting into sustained recovery. They may see like this is hopeless. Why would anybody want to do that? Whereas people who see the miracle realize there's so much hope in recovery. And I think that is what I have always believed has held me in this is that people recover, people get well.
Yep.
And there's an absolute miracle that happens. And how many jobs do you get to do where you get to be on the front row watching miracles take place every day? And that's been my driving force throughout my career is just to watch the miracle of recovery unfold. And so, and I've had people who've come back to me 20 years, 30 years later and say, you were my counselor X time and you taught me this, or you made this impact on me. I ran into somebody in May that I was, their counselor in, I don't know, 30 something years ago. And he said, I remember you told me about this, and I still, and he's a counselor now too. And he said, I tell people that today, so to feel like you have made that kind of a difference for somebody and then that they're passing it on, that's an extra plus for me.
I think it's a grand slam when you're somebody you treat eventually becomes a counselor. My story was I was in a sober living. They didn't call it that back then, but I was in a sober living facing jail time. And my counselors called me in their office with this serious look, right? And they said, I want you to read this book. It's on becoming a counselor. And I'm like, what? And they said, well, you have a way to confront people and they don't get defensive. And, I had probably 6-8 months sober, 4 or 5 months sober then. And I just remember going back upstairs and telling the guys in the program, I said, man, they're really hard up for help. They want me to go to become a counselor. And that's something I'm never going to do. I was like 19 years old. And lo and behold, my whole life's been devoted to this industry and this field. And then when I was an intern, my first client actually was a woman who had been married 3 years. Married 3 times. And she realized at that point she was gay and worked for Sally's Beauty Supply. I remember all these things. This was probably 1983, 84. And she ended up going to a program in Waco for sober living and ended up being an LCDC. So it's one of those things where it's, as a counselor, it's a great moment to see one, not only people getting sober, because you can't take credit for it because you got to take credit for the failures, but that you had a part in it, that the person went and got sober, more importantly, and then became a counselor to help others, like pay it forward. So that's why I think we need to do more to encourage our graduates of our programs in the treatment field that is an option for them. Obviously you got rules about how quick they can come back and work, but as a tech or entry level person, as they pursue LCDC hood or whatever. But I think we could do more to encourage that.
Yeah, I agree with you. We've lost a little bit, I think, of those just kind of. And one of the things I love about the intern program at La Hacienda is we're able to grow our own, so to speak. We're able to, bring those in who've just completed their training and they're there for their 2 years, and we really get to train them in those things that we believe in, the philosophy that we believe is really important. And so I'm sure you guys do some of that with Positive Recovery with an intern program.
Yeah, we love that.
And you asked me about just kind of some advocacy success stories. And we advocated for years and years for parity law. We're still advocating around parity law to continue to strengthen parity law. But I was working with our U.S. Congressman at the time, Lamar Smith. I live over in the San Antonio area. I build the greatest relationships with staff members of elected officials. It's the elected
Right.
official isn't always the target. The staff members are the target because they really are the ones who are bringing the information to the senator or the representative. So I had been working with his staff member for a good while, and I was walking out of my office at the end of the day, and the phone rang, and it was one of those times where it's like, do I just keep going or do I go back and answer the phone? And I went back and answered
Mm-hmm.
the phone, and I had been extending an invitation every time I went to DC to visit with this woman. I'd been extending an invitation to her and to the congressman, come visit us at La Hacienda, come visit us.
Nice.
And so she called me and she said,
Oh, nice.
hey, I'm going to be in the district in a couple of weeks. I would like to come see you, you know? And
Oh, cool.
so it was like, all right, something's working here, you know? And she did ultimately come and visit, and I was able to give her a tour and teach her and show her some things about, what treatment really looked like and get away from the stereotypes.
Nice.
She also called me, one day and said, hey, we're looking at this bill. And it had to do with when we originally passed the CARE Act. And she said, I'm looking at this bill and we have a couple of questions and I wanted to know your thoughts on it. And I always try to leave those conversations with those individuals with anything that I can do. Please call on me if you have questions around addiction services. And so,
Right.
she would do that. And then I feel like one of my greatest successes in doing advocacy work is before Congressman Smith retired from Congress, he actually came to a breakfast that I organized with the leadership from the service providers in his district. And he came in and I said, we want to give you the boots on the ground view of what's going on, with these things and what the needs are. And he came in, sat down, and he said, I'm here to listen. Tell me what you want me to know. And there was no stump speeches. There was no, this is what I need y'all to do for me.
Right.
And he took that information. And then there was, when the House passes a bill and then the Senate passes a bill, there are oftentimes different versions of the same piece of legislation. And so they have a conference committee that comes together and works out the differences. And so what I found out was Congressman Smith volunteered to be on the conference committee when that particular piece of legislation came about. And I asked him later, I saw him at a town hall meeting he was having, and I asked him, I said, basically, why'd you do that? And he said, no, he said, I volunteered to do that because, I had that meeting with y'all and I felt like I had some information that I wanted to share, and so I just felt
man.
Okay.
How cool.
And it's advocacy is all about relationships, George. And we as counselors know how to build relationships. Yep. We're good at that. It's just about building a relationship. And that is the best example that I've had in my advocacy career of really starting from scratch with getting, meeting people for the very first time and then developing to a point where they feel they can reach out to me, for my expertise. And that particular woman who came to visit at La Hacienda, she continued to stay in Congress as a chief of staff after Congressman Smith retired, and she went to work for a congressman from Indiana. And so when I'm in DC, I still go by and say hi to her, and I still know that if that congressman was a key person for a piece of legislation, I could reach out to her, even though I'm not a constituent anywhere close to Indiana.
Right.
I can still reach out to her.
Yeah. You have that relationship.
Yeah.
Absolutely. That's so good. So in this situation, I want to bring up something that always concerned me about Texas. So, and my stats may be way off because I kind of lost interest in what I was kind of thinking about and what I proposed. So we have, and maybe my numbers are wrong, so you maybe know the numbers better. I want to say it's like 6,000 LCDCs in the state of Texas, or FCIs or LCDCs, or I think that are in the state. But those only maybe like a certain number, like 400 or so, that are in TAP.
Well, let me update your number.
Yeah, update my numbers because I'm curious about this portion.
I just saw a graph. Interestingly, it was in the San Antonio Express News talking about health. No, it was in our local paper here, our little local town paper here, talking about mental health counselors being available to kids in school. And it had a graph about the different disciplines of counselors. And it said that there were about 11,000, I don't remember the exact number, but it was about 11,000 LCDCs. And that was in 2022.
Right.
And we have about, the number fluctuates a little bit, but it's about 900 members of TAP.
Yeah. So my goal was always to say, how can we bridge that gap where it's 11,000 TAP members? So when you guys go to talk to these congressmen and people say, I represent 11,000 counselors in our organization. And one of my proposals was to give everybody membership for a year. I told, because I know it has to go through NADAC, but say, give everybody a membership for a year and prove the value of it. And so the next year they hopefully will renew and pay for their membership. And so I told that to, I think her name was Cynthia at the time at NADAC. And I said, man, what if you did that for the whole country? How strong would make NADAC? But maybe there's some ways that we can try to help solicit that. I don't know what the numbers would be, but maybe get some donations or something. But I think TAP would have more, I don't know, you tell me, would TAP have more leverage in the state if all the members of all LCDCs were members of TAP? That help you to say you have that many numbers?
Well, certainly that would help. Mostly, I say that I represent the 11,000 addiction professionals in Texas.
Okay, good.
Because TAP is the one association that is advocating for the interest of addiction counselors and peer recovery support specialists and prevention specialists in Texas. So I say that. But yes, if we had more people as members, then we would have more engagement. We would have more of those 11,000 people actually engaged and hearing more about advocacy and perhaps taking some steps forward relative to advocacy. And so I'm with you. I would love to have, more than roughly 9 to 10% of the counselors.
Right.
And those are the LCDCs. Plus, we also add the peer support specialist to that and the prevention specialist to that, number of LCDCs. And we have prevention specialists and recovery support specialists that are part of our membership numbers for TAP. But,
nice.
And it, students have reduced membership at $65 a year, I think.
Right.
And a Texas professional membership to TAP is $140. I think people don't realize what all they can get for that money. And, NADAC has hundreds of hours. I want to say 300 plus. I may be off on that, but hundreds of hours of continuing education webinars available. And those are free to TAP/NADAC members. Really, the access to very reasonably priced professional liability insurance. And they even have policies for peer support specialists, which, you don't find that in very often. So having that layer of protection to have your own professional liability policy, of course, the representation, on behalf of your profession and your field, lots of other things, discounts for our state conference, for the national conference, various other things, just lots of publications that NADAC has. And there's other partnership. I think there's a partnership through NADAC where there's a discount on Hazelden publications, and that's a huge publishing group. So it's people, you're right. People need to understand the benefit and how do you get them to understand the benefit? And it would be great if we gave everybody a membership. We do a good number of scholarships for student members for that first year of student membership. But I also think too, George, if I see seeing myself as a professional, is an impetus to me wanting to associate to connect with my professional association. And I was having a conversation with somebody yesterday is that we are addiction professionals. And it doesn't matter if you're a recovery support person or a counselor, a brand new counselor, even an intern, even a student in pursuing that. When I'm being paid and when I am having to adhere to a code of ethics, I have a requirement for my education, and I have a certification or a license, that makes me a professional. And I think for especially folks who have come through their own addiction journey and are entering in recovery, and maybe their past vocational history has not been stellar, they may have difficulty transitioning into seeing themselves as a professional. And I think something that people like you and I can do, and other folks that are, doing, practicum sites and intern sites, is helping people to really understand that, yes, you are a professional. And that's also part of our recovery journey and how we see ourselves professionally.
Well, I love to figure out, and I'm trying to do the math, and it looks like it'd be a lot of money if somebody wrote a check to just have all the non-members become members. So that's not realistic, but I'd love to figure out if we could do a pilot in Texas to say, hey, what if that happens? How many? I guess it's like a gap of 10,000 people. So if it's 10,000, how many? For when renewal comes, can we capture 1,000 of those, and double the size of TAP? It'd be cool to see if that, we figure out some kind of, and I'd be glad to be on a committee to do this, but to figure out a way, if we could give the free membership for a year, then what would be the second year's recruitment, and what would it do for the budget, and what it would do for the advocacy and everything that goes along with it, if we can show that the value of the year that's free, and 10%, 20%, we can recoup our capture as net new members. I'd love to see that.
That's a noble idea.
Yeah. So if you talk to the powers that be and they are interested, I'd love to be a part of that activity, because I think it could help us in the long run.
You have some Houston-based TAP board members there. I'm not on the board anymore. You've got some Houston-based TAP board members. You could put a bug in their ear.
I will. That's a great way to push me to do it, because I want to find out I'm gonna find out who they are, and I'm gonna contact them and encourage them to think about this idea, and I'll try to put it on paper.
Great.
And see, because I knew back when I studied it back first time around before I sold the right step, is like I was interested in that dynamic of how to do that to get more members.
There are some employers in the state who pay for their employees to join.
Yeah.
And I think that's really helpful.
Yeah. That's a good idea. We can do that. Positive Recovery needs to do that for sure. I don't like to put all their skin in the game, but maybe we'll pay half, and the members can pay half. See if we can make sure all our employees are members.
Yeah.
That's a great thing to push us to do that. What can somebody that's interested in this? I mean, obviously you won't do it forever. You can't do it forever. How can we cultivate more Sherris down the line, or what are you doing to have somebody take your steps when you step out, or whenever you retire? It doesn't sound like you will in a long time, but when you do retire, how can we get some more use?
I have never forgotten Frank from Long Island, and he said, "Come with me," and that's what made the difference for me. And I tell people anytime I do an advocacy presentation, and I tell people, you come and I will make sure that you are not left alone. I will make sure that I or someone with good experience is with you, shows you around, goes to your appointments with you. And we live up to that. And so Colleen, who works for you in Georgetown or Round Rock,
she's great.
She has been super excited about advocacy and getting involved and doing good things. And she is one that I have said, come on, let's go. And she's taken me up on it, And so
nice.
I'm, make sure she gets to Washington, D.C. in October. Okay.
I'll make sure of it.
As the boss.
Yes.
But so that is, we do several things. TAP partners with the Association of Substance Abuse Programs and Recovery People. And we sponsor in November of even number years, so it'll be November 13th this year. We sponsor it's about a 5 or 6 hour training day in Austin called the ABCs of Advocacy. And it's teaching people about, how legislation works, and then how advocacy works, how to be good advocates. And then, so that's a great first step for people is to come to that, because we're really going to teach you a lot of the things that you need to know. The second part of that is you got to show up, and you just have to. When we'll have Capitol Day in Austin in the spring, we're not able to set the date for that until they open up certain things on the Capitol calendar, which doesn't happen till later in the year. But we will have Recovery Day at the Texas Capitol in the spring, where we will people will make appointments with their senator offices and with their representative offices and go and talk about what the issues are. We have on October 22nd in Washington, D.C. The same way I was introduced to advocacy, NADAC's annual conference is in D.C. this year, and we have a Hill Day attached to the end of it. So October the 22nd is that day. You don't have to go to the national conference to go to Hill Day, but it is attached to it. And then through TAP, we do some, kind of legislative updates and policy updates. And through NADAC, we do those things as well. So, because there's federal legislation and there's state legislation, and they're two different pools, to draw from. But, I don't like to be a talking head. I never want to be put in a position where I said, here, go say what's on this piece of paper, but you don't need to know any more information. That is just irritating to me. And so we really work to make sure that people have the background, that they get legislative briefings, that they have enough information to where they feel like, okay, I understand a little bit about this. And then the key piece thing for George is, how does that relate to you and what you do and the needs that you see? It's kind of like me going back to parity. Was I worked and I work for an organization where most of our patients have commercial insurance. So parity in insurance coverage was something that I really understood, because I saw people who couldn't come to treatment because they had already used their 3-time lifetime maximum or their $10,000 max benefit. Those kind of things that were very common before we passed parity law. So I always encourage people, what are the issues and how do you relate to them? So that you can tell a story that feels comfortable. That you can tell a story where you feel like you're talking about something that you know and you understand.
Parity has been so good for our industry. One, because what you're talking about the clearing the different little policy gimmicks that they had to limit the addiction treatment. But number two is the Affordable Care Act, when the kids could be in their parents' insurance till 26.
Right.
Because we used to get tons of write-offs. We'd have these kids in college that would drop out because of their addiction. And you call to verify the insurance, and they say, yeah, the insurance is good. But then when you file the claim, they said, oh, no, he wasn't in school at the time of the treatment, so the treatment's not acceptable or voided. So we'd have tons of write-offs. And so that's actually helped our industry as well. So those are the kind of things for the people listening that, advocacy makes a difference, is to educate what the issues are and how to overcome them to help people get treatment. So as we wrap up, I don't want it to go too long, but we could talk about this forever. Are there any burning issues right now that you're fighting that you think is really important that people can talk to their congressmen, talk to their senators, talk to people to help overcome? Is there any issues that we're facing that is pressing at the moment, or that you're working on, or anything that we could help with? Or
Well, I think that the number one most important thing that anybody can do relative to advocacy is vote. Make sure you vote.
Yeah.
I don't care who you vote for, but vote. Yeah. I do care who you vote for, but I'm not going to,
Yes, I was about to say, we got to make sure they're pro treatment.
But vote. That is the first and foremost thing. But then, a federal issue is we are really trying to expand substance use disorder benefits for Medicare beneficiaries so that they have access to a full continuum of care. Right now, there's no residential benefit for people who have Medicare to go to residential substance use treatment. And so someplace like some of your programs, La Hacienda's program, Medicare can't come there.
Yeah.
We also they just added an IOP and a PHP benefit to Medicare, but the providers who qualify are so limited. You wouldn't qualify. La Hacienda's IOP wouldn't qualify. They have to be part of a federally qualified health plan. They have to be an outpatient department of a hospital, part of a rural health clinic, and part of a.
And most of them don't do addiction.
And so, so many, especially in Texas, rural Texans don't have access to those types of programs. So what we want Congress to hear is Medicare beneficiaries need to have access to a full range of IOP and PHP providers. Those that are already licensed and accredited in their state should be eligible, and that a residential care benefit should be added to Medicare. And then from the state standpoint, we'll go back into session in January, and hopefully this session will be less eventful than last session was. But we really need to update and modernize our existing patient brokering and solicitation laws. We have those laws on the books from 1993, but things like the internet wasn't even an issue in 1993. So internet marketing wasn't covered in those laws. And that's where a lot of the worst practices are happening.
Oh, yeah.
So we need to update our patient solicitation laws and our ethical marketing practices law.
Yeah.
Also, we need to make fentanyl test strips easily available and have them taken off the drug paraphernalia list. So in Texas right now, fentanyl test strips are considered drug paraphernalia. We need to fix that.
That's terrible.
So that's a federal piece, Medicare's, and then on the state, the updating our Ethical Marketing Practices Act, and also getting fentanyl test strips off the drug paraphernalia list.
Do you think Texas will ever expand the health care under Medicaid, that more people could qualify for Medicaid? And then secondly, the last time they ever touched Medicaid rates is probably 20, 30 years ago. So the rates for care under Medicaid are so bad that most people don't want to help them. You see anything that's ever going to shift?
I know that there's a lot of people who talk about what a problem that is, and also the rates for state-funded programs that provide substance use services, they're equally dismal. And unfortunately, we're losing a lot of those providers because they just can't do business at the rates that the states are contracting to pay. There was a rate increase in the state contract last year, but they increased outpatient groups and outpatient individual counseling significantly, and they did not increase the residential rate hardly at all. So now you get more revenue from doing outpatient group and individual than you do residential care. It's crazy. Just makes no sense whatsoever.
It don't make sense.
Do y'all understand what treatment is?
Yeah.
And the Medicaid piece, the expansion, I don't, because I've not ever dealt as a Medicaid provider. I don't, but I have a lot of colleagues through the Association of Substance Abuse Programs that do take Medicaid, and I know that the rates are very bleak. And those rates are set state to state. So in Louisiana, the Medicaid rates, from what I understand, are decent. So we have to keep working at that. And I think those providers who are affected have to really make their case and keep putting the facts forward. This is what it costs us to provide care, and this is the gap to what you're willing to pay. And then also, people that suffer from addiction, to me, George, they've gotten more and more complex over the years, and oftentimes they have a higher acuity, and there's we just have more complex treatment needs. And so that has to be recognized in the rates that people are paying. You need the staff that's capable of handling some of that complexity. I hear a lot of conversations with my colleagues with the Association of Substance Abuse Programs, and it frustrates me. I wish I knew how to fix it. I wish somebody knew how to fix it. But I think the big thing is we got to be the squeaky wheel on those issues.
Yeah. The more people we can get help, the less prisons we have to build.
Exactly.
To save money and less hospitals that they show up in ER. But
yeah.
It takes a convincing. I wish I was more of a economic major to show the data on that stuff, that what we can prevent with the money they spend saves money in the future for sure with treatment.
So many of the big social challenges that our state and our nation faces, you and I know they come back. Addiction is a factor in so many of those things. I've heard state officials report anywhere from 65% to from 2/3 to 3/4 of children that are removed from their home. It's because of substance use with the caregivers. We know high rates of people in the criminal justice system that substance use related issues, folks that are homeless. Oftentimes mental health, substance use is a key factor in those situations. ER visits, truancy from school, dropping out of school, all those the list goes on that substance use is a key factor. And the ROI on that is crazy. If we address addiction, even if we provide good, solid treatment for those parents who are losing their kids in foster care, if we provide good, solid treatment for those parents to have a good chance of recovery and restore those families, what a great thing, it's so much more effective than supporting a child finding the tax implications of children in foster care.
Well, I just learned the highest level of foster care, whatever the level of severity in the foster care system, that if they're the highest level, which I think is 4, the provider gets paid $1,800 a day. And that's just to house them, not even to provide care. And they want to pay $100 a day for addiction. That, like you said, we can, if it was half $1,800 or even less than half, we can provide treatment for the parents so they don't even have to be in the foster care home. So think about those numbers. Amazing.
I've never heard that high rate for foster care, children in foster care. I've never heard that high of a rate. That's a huge.
Yeah, the highest level, the most severe level is $1,800 a day. And they just warehouse them because I'm involved in a nonprofit, and we're starting to provide the counseling that's paid by Medicaid, because if you're a foster care, you're under superior health care, you're automatically enrolled in Medicaid if you're in foster care. So There's so many systems that their money's flowing, but not always in the right direction or used wisely.
Yeah.
So we can talk about this forever, Sherri.
Exactly.
But thank you so much for coming on, and Dr. Powers for allowing me to be his guest host. And that's it. So we hope to see you soon, Sherri.
Well, thanks. And maybe we can get back together closer to the beginning of session and talk about what some of the priority issues are.
Thank you for listening to this episode of Positive Recovery MD. Don't forget to visit positiverecovery.com/podcast to sign up to get your daily positive interventions sent straight to your inbox. Be sure to subscribe to Positive Recovery MD on Apple Podcasts or wherever you listen to your podcasts to receive an automatic download when a new episode drops. And as always, if you or someone you know needs help, visit positiverecovery.com or call 877-4-SOBRIETY. That's 877-476-2743. Our why is simple. We care. We are here to help.